I need to talk to you all about your appraisals. So it'll probably be a tomorrow. No one needs to worry. There's no fail in there from this group at all. So everyone's passed. So what I do is rank you 1 to 5 in all of these categories. So the first one asks me how you comply and practice according to relevant legislation and local policy. So these are the things that you need to be doing. Now to score a 5, you are in the top of the top. So there's almost no 5s for anybody. And that's across all the facilities. We all spoke today about where everyone's sitting. So 5 is at that RN level. Mm-hmm. Yeah. I rank you at the point you should be at the moment. So I'm quite fair with my marking. So I don't expect you to be at like a third year or final placement. So I'm ranking you at the point that you are today for where you're meant to be today. But we do see students that come in that have worked as AINs forever and that are doing all these things. So any question about this first one? I don't think I'm concerned. No one. So this is about uniform code, wearing your name badges, which you've all been doing. No nail polish, you're all doing. Showing up. You haven't got nail polish on, have you? Clear. Nothing, yeah. Good. So I have to send you home. Showing up to work on time. You're all doing that. The argument that we had with some of the facilitators in scoring a 5 for this is knowing where to look up policies and procedures. Mm-hmm. Yeah, so it's looking up those policies and procedures all the time. So if your patient's got influenza A, where do you find that policy?
In front of the door.
In the folder first and then...
Up there online, NSWC app.
You would find it on the internet. So, this was really hard for me to find because I had to find the influenza A one the other week. Is this me? No, it's not even me signing. Okay, so you'd find it here in infection control. And then you go influenza. That's 2019. They don't update this
Infection control.
See, look here, otherwise there's a care plan on your wards. It'll be on the back of the care plan on your ward. Cool. So you'll find this piece of paper. And when you go to infection control here, so if you pop your patient on, and this is something a nurse does, this is not a doctor. If you pop your patient on infection control procedures, so when did you start it? Did you notify? So a lot of you are seeing notes for infectious diseases. These are things that we need to notify the government about. So they look at those things, particularly with people coming in or out of the country. You would have had to answer lots of questions when you came in about where you've been. So if we started seeing, say, rabies, which is not common in Australia, they'd start looking at where those people had been. So so if you had a patient with rabies, someone might come in and contact that patient and go, right, what countries have you been to? Where have you been? Let's find all those other people. On the back page, it's got all the, so influenza is, is it droplet? Yeah, so is it droplet precaution? And it should say, I couldn't find it. So this tells you what you need to do. I told you I had a lot of problems finding this. I only honestly tried to find this. Okay. So they're on droplet precautions for 7 days after onset of an illness or 5 days after Tamiflu. So your patient Asteria, who's day 9, would actually be appropriate to come off contact precautions at the moment. So these are the things that you can be doing and looking up. A lot of it for you guys where it's going to be hard with the ANZAC standards is having that confidence. And confidence, if you looked at me as a first year nursing student, I knew nothing. You know, and you were doing so much better than what you were supposed to do in this room. And that feedback is hospital-wide. It's coming from every facilitator. It's coming from your CNE. So a good example is I bumped into Mel this afternoon and she was telling me how good the students are in the cardiac ward. Yeah. We had a contact from your university that wanted to know how good all the GEM students were going. So my big boss came to our meeting this afternoon and said, right, who's having problems with their GEM students? And we all went, none. Not one of you. So you need to be really proud of yourself somewhere you're sitting. But that's a big thing for you guys, will just be your confidence, and that'll come with time. If you had too much confidence, then I'd probably be talking to you about it. All right, the next one is ethical framework to guide your decision making. What does that mean?
Where is it? The framework.
That's part 2. So 1 and then you go 1.2. So the second one down.
Okay.
Asking patient consent.
Yeah, consent, ethical. What else?
Involving family.
Yeah.
Involving social workers if
Yeah.
needed.
You know, maybe like an Aboriginal liaison officer getting involved, talking to more people, allowing time to them. So it really isn't that referral, that empathy and just what's ethically. So you've got your code of ethics. Are you all familiar with your code of ethics?
Yeah.
Yep.
Yeah, so it's those sorts of things. Right, your next one is demonstrates respect for individual and cultural, including Aboriginal, Torres Strait Islander preferences and difference.
I have a question. How would I know he is or she is the Aboriginal or not?
It doesn't matter, you can't tell. There's
Right.
no way. So I could be Aboriginal and you would have no idea.
But
It'll
it
be
does
a
come on the history, doesn't it? If you say patient
Sometimes.
information.
Sometimes.
Yeah, we had a patient recently, face come up on the
Sometimes.
sometimes. It doesn't have to be.
It doesn't matter if you're Aboriginal or
Yeah.
not. We treat everyone the same.
Yeah,
It doesn't matter if you're in jail or you're
Yeah.
not. We treat everyone the same in nursing. It's not. Our job is just to make them better.
yeah.
It is not to judge anyone for their
Yes,
race
yes.
or colour. This is one where I think you guys should be definitely scoring higher, particularly coming from other countries. I'd be very surprised if you were to come to Australia and be racist. I don't see, you know what, I just don't see it.
Yeah,
I don't see you
yeah.
here and go, oh, I don't want to work at that hospital, there's too many Indians, or there's too many Chinese there. Like, you're just not, and I think you would know what it's like to come to a country and be of a different race. I would imagine it's not easy. It's probably better now than what it would have been back in the 90s. Yeah. Do you experience a lot of racism, do you think?
Yeah.
Yes.
With, like in my workplace with the residents, but they have dementia and those kind of things, I don't care. But not with the person who is mentally
Yeah,
stable.
yeah.
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 Yes. Yes,
You
that's
always
correct.
get it in dementia. Because that, back in the 90s, so back when those people were young, you just didn't have, like my grandmother would have called you all new Australians.
Oh, what?
In other words, you don't, you know, and I'm
It's
like,
funny.
Nan, you can't say that. She's like, yeah, what about the new Australians down at the Chinese restaurant? Nan! So it's a different generation as well. These days, it was, so like, I'm nearly 40, and so it was drilled into us at school. And then my kids seem to think you can be an animal if you want to be.
Yes.
So
I
now,
know. I know.
Right, so I think you would all mostly score pretty high for that. Sources critically evaluates relevant literature and research evidence to develop quality practice.
Policies, procedures.
Yeah, so it's policies and procedures, but a lot of policy and procedure comes up in the first one. So this is your local policy, so 1.1. This is where you're going and looking at research. So you're looking like at clopidogrel. Is clopidogrel the best thing for a patient who's previously had a STEMI? Or should it be a different medication? Yeah, that's what that one's looking at. So starting to challenge those things based on the evidence. You are all where you need to be. So when I mark you, welcome. Let's see. Good thing. We're just talking about, so this is the ANSAT. So I need to give you guys an ANSAT. They're all written and I'll probably do it tomorrow. I wonder if this is going to show. I can't even open up a fake ANSAT because I've got all your marks in them to open one up. I'm just trying to show you an ANSAT and scoring. Oh, there's an ANSAT. Okay. Alright, so this is what I get. So if you get a 1 or a 2, you are straight on what's called a clinical learning plan. So some of you I would have already, I've pulled you up on things. So I've said you need to do this or you need to do that. So examples are counting respiratory rates with clocks. Examples are wearing gloves. Examples are knowing your medications before you go to dispense. Yeah. So I've sort of had chats with some of you once. If those chats happen a second time, then you would drop you straight down to a 2. So you'd be below the level. So then I need to initiate what's called a clinical learning plan, which isn't a bad thing. 10% of students go on clinical learning plans. That's just about putting set strategies in place and working with you and just going, okay, why did you not wash your hands every time you walked out of the room? What's happening for you? Like, how can we, So just putting those things in place. If you are at a second year level, so you're in your last placement, and I spoke to you about any of those things, it would be an instant fail. So if you come back and you're with me as a second year final placement and I see you not washing your hands, clinical learning plan straight up. If I see you not using a clock to count or respirate, instant clinical learning plan. That's a failable. But on your first placement, lots of these things are just things that you're not used to doing all the time. Right, so 3 is where you should be sitting. So 3 is at a standard level. Yeah. That's where most of you sit. A 4 is at a proficient standard. So that 4 is a really good standard. And then 5 jumps up to excellent. So 5 is you're doing it like you're an RN. Yeah. But it's you're doing it like you're an RN, but you're still a first year GM student. Does that make sense? And I know it seems crazy, but every now and then, so we see students that come through and they're just doing it. So there'll be things for some of you guys where, I'll talk to you or I'll say you're so close to a 5 because this is, So where you're close to getting a 5, when I go through the answer, I'll say you are so close to a 5. And I'll talk to you about how you get to a 5. Yeah. The next one is on therapeutic. So the green comes on therapeutic and professional relationships. The biggest thing that I'm seeing in the room when it comes to communication is not being direct enough. So just being a bit more direct with patients and just having those conversations with patients more often. And it's just because you're not used to that normal Australian small talk. Yeah. But to score higher there would be where you're just being that bit more assertive. So you notice who did I do? Yesterday we went in, we found the patient that wasn't waking up.
Oh, yeah.
Yeah, and you went in and you're like, hello. And I'm like, Ross! Yeah, it's a big, scary nursing boots on. So sometimes as a nurse, we have to be really, direct. And even the most quietest nurse, you'll still see go in and go, Ross!
Really?
They're
because
learnt
it's
skills.
not clear.
Yeah. So it talks about that. You can have a read through. Any questions on the therapeutic and professional relationships?
How can you improve our small talk level? Because of we don't have any questions of them or nothing to do. We can
I would just sit in the room and just say, what did you do for work? Yeah. What were you like as a kid? What was your childhood talent? Yeah. What's your neighbour? Do you have a good neighbour? Who's your best friend? What would be your advice to me as someone in my 30s? What would be your life advice to me?
Sometimes this question, I think, is this too private?
There's no such thing as private in nursing.
Oh, okay.
Yeah, realize that few days ago.
Yeah, there's no, so take away those private, there's nothing. I can go in and
Just talk.
about, I can ask you about anything. There's no
Limitation.
limitation to your conversation.
Good.
You just go where they go. Because no other job gets to be with people when they're dying. Yeah, no other job gets to be with people when they're at their sickest moments. And so people will want to have really raw conversations with you. And they will. People will tell you things and you will just sit there like an utter mess, just crying your eyes out, just going, woo. Yeah. So you'll develop a lot of those strategies. It's going to come with time.
Cool.
Yeah. You're all really keen. And I can see that. It's just one of those really tricky things. There's no way I could ever go to another country and nurse. I could not learn another language. I would not pass at uni, and I could not adapt to another cultural heritage. So what you're doing is amazing, but it's really hard. Those communications will come up. Yeah. All right. Maintaining the capacity for practice. This is where you guys have scored really high. As a group, so not everyone might, but this is where you're doing so well. So good examples of that is, you sent me goals again this week.
Yeah.
The strategies. Your reflections have all been good. There's a little bit of AI in there, but they're good. Unless I spoke to you directly about a problem with your reflection, you're asking questions. If I tell you to do something, you do it. Okay, you're not challenging me. That's what all this is about. A lot of students don't score high here. So you're scoring, when I go around and look at some of the research that you've done, it blows my mind how much you're understanding. Because you haven't done your pathophysiology yet. But if you can understand to that level, when you do your patho, you'll realise how much you don't know. But it's really going to help you.
Okay.
Okay, health education. comes under capacity for practice. So health education is where you can stand up to start, when you go into a room and you can say to a patient, I'm going to give you these medications, this is what they're for. Yeah? It'll come naturally. Oh, what do you do about your type 2 diabetes at home? Oh, you know, have you thought about doing this? Have you thought about doing that? Yeah? So that's that education that we're providing patients with all the time. So you're not scoring high there yet. All right. Taking appropriate action when capacity for own practice is impaired. You will all have seen bad practice while you've been here. There is dodgy nurses. I know there's dodgy nurses. This is where you're starting to speak up and say that's not okay. Yeah, that'll come with time. What's important here is that you never do some of the things. So one of the dodgiest things I ever see is, you know, when your patient's got SATs of 94, what have you seen nurses do?
Just document it, and rather than saying try to take deep breath, rather than saying just document it. 95.
Yeah, that's illegal. That's currently sitting with exec. The other thing that's illegal is saying just take a deep breath.
This is inappropriate. We cannot do that.
Very inappropriate.
Oh.
But everyone is
Yeah,
doing
Yes.
Yeah, very, very inappropriate. You're lying. You're lying straight to the computer. And the second you walk out of that room, those numbers are going to drop back down again. Aren't they?
Yeah.
Do you actually think a patient can take a breath and that's going to fix them? Otherwise, why don't we just have someone standing at ED going, take a breath before you walk in? Yeah? So a second you go in, you get them to take a breath. The oxygen will go up for 2, 3, maybe 4 seconds. You get your 95, you take the flat spray off and you walk out of the room and then it's back to where it was. Very, very bad practice. What's the problem with telling the computer? So why people have stopped doing it is because you tell the computer and then you have to bring a doctor. Yeah, but that's patient safety. If you were the patient in hospital and you were sick and your nurse told you to breathe up and you felt sick, how would you feel? It's yeah, she doesn't care. She doesn't care. Like, she's fudging the system. She's dangerous. Yeah. I had one recently, and I was in hospital, and so they'd tell me to breathe up, and then my blood pressure was low, and they'd say, oh, you've always got low blood pressure. I'm like, okay. No, I don't. But it's just, yeah, it's dangerous. So breathing up's really bad practice as well. But it's something that is the first year that you see, but it's definitely with hospital executive at the moment. They know that it's happening out there.
What is the right thing to do? Like your patient had, he had some kind of weird AF while he was in surgery stuff, and anesthetic came and everything explained this is happening, his saturation was a bit low. And he's always sitting at 94, 93, but he got that, you know, the yellow smiley thing. They breathe in.
Our TriFlow?
Yeah,
Yeah.
TriFlow. So what do you do with, like, if he's sitting on 94 basically, and that's what they do, they tell him to breathe in, breathe out, and it goes up, and then that's fine.
So you tell me what you do. What would I do?
Doctor,
Team leader.
clinical review.
Follow the policy. What does the policy say? What do the rules say?
Clinical review.
It doesn't even say clinical review. It just says you need to tell your team leader.
Okay.
And then the team leader can just say, yeah, I'll ring the doctor. And the doctor just puts an alter calling criteria in place for 93. Pretty simple, right?
Yes.
And then everyone just tells the computer the truth. Because when the patient gets to ICU because they do deteriorate, the first thing we can do is just go, you want to tell me how this person's had a blood pressure of 100 every day and how they've had a like a SAT of 95 every day? Like, come on, like, You can see their bloods are all going out of whack
Mm.
because there's people lying.
Mm.
No one sits at 95 every day. Yeah. Do you think the doctors are stupid? Do you think your boss is stupid? That would be my one thing to you. So while you're a student, sometimes you've got to keep your peace. But when you come out and you're registered, that is not okay. It is dangerous. In this hospital, we have lots of junior staff. We have lots of problems staffing it, and so that's what we know that we're seeing it. That's not good enough. So that one talks about when you're starting to identify what's happening wrong and when you're speaking up for patient safety. And the next one just talks about demonstrating accountability for decisions and actions. Right. Then it goes on to conducting assessments. So in assessments, that is things like doing your head to toe assessments at the start of each shift. It's doing your Waterlows, it's doing your Framps, it's, doing, if you've got, who's got a Bellovac? Someone's got a Ting? Yeah, you've got a Bellovac.
Yeah.
So it's like going in and assessing that Bellovac regularly. So that's what that is. So it's doing those assessments. The next bit is having the ability to be able to interpret those assessments. So what does that mean if you've got creps on the chest? What does that mean if you've got no bowel sounds? What does that mean if you've got a new edema? What does that mean if there's 300 mils in your Bellovac? So you're not expected to score high. That would be almost impossible to score high. What you are doing well, though, is asking questions. And you all know your ranges. The other thing that I've heard of a student doing is going and getting all their OBS. So this is me telling you this is not okay. They've gone and got all the OBS for the patients, which I'm sure you guys are doing, but 2 of those observations were abnormal. So if you went around and you got all your OBS on your 4 patients at once and then took them back to your nurse and popped them in the computer, if anyone is abnormal, if anyone has a SATA 94, you need to go straight to your nurse straight away and say, bed 17 is. You don't keep going. Does that make sense?
Yes.
Yeah.
Yes.
Yeah, because that would be a learning plan. Okay, the next one's about your plan for nursing practice. So again, it's talking about using that assess the evidence. So looking at, who did I look at best practice with today? You. We looked at best practice guidelines, but it didn't have it for spleen fracture. We looked at the spleen.
All the plenty,
Yeah.
yeah.
So that's starting to look at what is the best practice for someone who's got a spleen fracture, and then starting to pop those things in your nursing plan. Yeah. So like he probably might need a HB later on this shift, depending on what your assessment findings are later.
She's having tomorrow,
Yeah. So just starting to look at those. So that's what that is. And then formulating those goals for your patients as well. So you're all doing well. You're all starting to do that. But there's just any questions on that one?
Sometimes I'm not sure how to say that the plan is about. It's not easy to how to say the plan, next plan. I can do in the assessment, but I'm not sure how to do it because of all the patient is as usual. We can give the patient give the medication to patient, and then. What can I do the next plan? How can I say that the next plan?
That'll come with time. These things will all come. And between now, from where you are now to your final placement, you guys will grow so much because of the rate that you've even grown in a week. You come here in your last placement and I would be very surprised if you're not all scoring 5s. Because of how hard I can see that you're working. But your plan is about, you've got to have that critical thinking there to be able to develop your plan. Yeah. Any other questions on the plan? Provide safe, appropriate and quality nursing practice. So this is where you're starting to, following guidelines, patient safety, using resources, respond to rapidly changing patient-client situations. So it's just about having that critical thinking again. That one you've actually scored a right for. The next one is provide effective supervision and delegate safely within their role. So some of the ways that a student can delegate is handover. So when you go on your break, you would say, oh, I'm going on my break now, bed 17, just needs to have a set of obs done at 6:15, and then you give the patient, you just give the nurse a little handover on what's happening with them and where you're at, and you'll go. That is delegation. Yeah. When you're saying to your nurse, when you start jumping up, so some of you now have 2 patients, and you're just saying, oh, can you just help me? Can you do a set of obs in that room because I'm caught up here? That's delegation. You'll see the nurses do it all the time. Yeah. Responding appropriately to practice that may be below levels. So that's responding to incidents that are unsafe, and clarifies care delivery what might be appropriate. So this is talking about, again, things like that, breathing up for your SATs. Yeah. Evaluate outcomes to inform nursing practice. So this is your discharge planning now. Looking at that holistic cares. Who do they live with? How many stairs have they got? How are they coping at home? And then modifies plan according to evaluation of goals. So that's starting to do a care plan for your patient. So is this the first time you've seen this?
I've seen it, but I didn't read it.
Yeah. So this is the nursing standards in Australia. I need to do all these things, and I need to sit at a 3, or I don't have a job. This is what so when I pay my APRA, I need to be at a 3 for these. So that's, and I probably score a 3 for a lot of these things. So this is our nursing standards in Australia. I do believe this is being changed at the moment, and it's going to change next year.
Why?
Because things change all the time.
Oh, okay.
I don't know. You might talk about AI now, or
Just one question.
Yeah.
With the training or the saturation thing, I've seen the recovery nurse or therapy nurses comes in. Sometimes they don't put them on their finger. They put them on their toes. I've seen a couple of them, and it works really good. It just comes like nice reading, and is it okay to do it?
yeah.
Yeah, because the nurse came, she was like, oh, she put on the hand, and because she knows I was doing off, she seen me before doing it, she was like, oh, I took over your job now, and this is what's happening, blah, blah, blah. She was like, oh, it's not working on the hand. Let's put on the floor. And I was like, oh, she was like, why do you do that? She was like, it's just a better reading. Is it better reading?
Yeah, it depends on, it's not a better reading because it's further from the heart.
And plus, I think it's warm, you think?
Yeah, warm. So they probably have their hands out during surgery, so they're cold and shut down. So often we try on the ear.
Oh,
In
yeah,
ICU,
yeah.
I've got a skin one, so we'll often pop like a temperature probe on their head. Yeah. I can pop temperature probe, or like those temperature probes, so a different one, actually in a bladder on the ear. But yeah, so you can get all that from here as well.
So if someone like is on 94 on the fingers, but you want to try and
It comes to a waveform. So on your machines, you'll have a waveform.
Yeah, away from yes.
Yeah, have you seen it?
Yeah.
And it should look like this.
Yeah.
So what I say is if you wouldn't surf it, it's not true. So if you get little lines like this, would you surf that? Does it look fun? Does anyone surf?
No.
No, what are you doing on the Gold Coast? Right. You wouldn't surf this either. But these are all big, they're all the same, and they all look perfect. Yeah? That's good waveform. all the same and all big. This is absolute rubbish. So if you pop it on and you're seeing this for your waveform, it's telling you lies. It's not even true. Even if it says 97, it's still not true. Your waveform needs to look like this. What I've seen nurses do is get 91 with a waveform like this, and they'll go, just breathe up. Go to the nurse, did you have a problem with your waveform? Why are we breathing up? If you're seeing large trends of that though, please feed it back to me and I will talk straight to management about it. But yeah, I know they're aware. Right. Did you even know that you had answered appraisals that I had to do at the halfway mark?
I think they said something in the orientation about 2 assessments being
Yeah.
informative and summative or something. Isn't that?
Submissive.
I don't know. I'm
means?
so sorry. I'm not.
You do?
Summative. She keeps telling me. She keeps saying, I don't know. It's a 2 with INS, and I don't know. But she was keep correcting me. Like, no, it's not that. I was like, I don't know. I just heard from someone.
Don't say submissive.
Sorry, I understand.
Do you know what submissive means?
I think I know a little bit now. With your
Jamila does.
Yeah.
He one does.
With the expressions, I know now.
No? I can't look it up on the computer.
No. Watch the movie.
I can actually, because who's logged in, not me.
Don't go in the incognito.
Oh my gosh.
All right.
There you go.
What?
So this is submissive.
I'm sorry, it's just wrong words. I didn't know what I was talking. There's two assessments, okay? Something like that, but not this.
So he's the boss and she's like the slave. So they wrote that 50 Shades of
Oh,
Red.
great.
Oh, yes, I know that. Yeah, I know.
So no, I'm not doing a submissive assessment.
That was like, she kept correcting me. I was like, I don't know what it is. They said something about it. And she was like, no, that was reflection. I was like, I don't know. They said something. Okay? So we're getting something in the middle of these 3 weeks. So that was this, okay? I get what I said.
I don't know, you are making trouble all the time.
Me.
You are blushing.
Yeah, it's her.
Because she knows what it means because she reads the book.
Yes, you know that.
No people putting you in trouble.
Anyway, don't go home and look it up. It's honestly, it's crap. It's violence against women, I think.
That movie.
Oh, I hated the movie.
Oh,
It's
yeah,
the worst
yeah.
movie I've ever seen in my life.
The
Oh my
funny
God.
thing is the nursing I work in, so they have this 50 Shades of Grey books, the whole editions, and the lifestyle came around, and they were like, "Why would you have these books?" And I was like,
I think it's pretty much
I don't know.
different than the book and the real movie. They,
"I don't know, I didn't,
they
Mm,
make some,
That's right.
yeah,
I didn't read it."
The movie was too much.
yeah, unnecessarily. Yeah.
You don't need to watch the movie. You don't even know what movie we're talking about, do you?
I know the movie, but I've never seen that before. I
That's
never
rubbish.
watched that before.
That's another one. 360 days or something. What was that? 320 days or something like that. People are crazy about.
Yeah,
it.
yes, I know
Why?
that. 30,
Oh my
30,
God.
30, 38 after that. Yes, yes,
Okay.
it's really
It's
funny.
always trending on the Netflix when it comes.
She watched it.
I just know that movie.
Okay.
I know that.
know.
You're going red now.
Yeah, I know too well. Yeah.
So, so not submissive.
Yeah, sorry.
Anyway.
And don't tell the uni I taught you that. So the first one I do is a formative assessment. So I will talk to you all tomorrow and I'll go through your formative assessment. It's just an informal chat. And so the first question I ask you is, what are you doing well? Yeah. And then the next question I ask you is, what do you think you can be doing better? Where do you need to improve? And then I tell you where you're doing well, what I think. And I tell you where I think you can do better. So down the bottom of the assessment, it asks me 2 questions. what has the student done well throughout this placement? So I would have wrote in here what you've done well. And then I talk about what you can do better. Sorry, this is the first one. What can be improved and how will this be achieved? So what do I think you need to be doing in the next week? Then you have a chance where you can go in and you can write your comments.
All right.
Yeah, so you can agree with it or you can disagree. If you can if you can prove to me that you've done a lot better, then maybe you have, and I'll change my score. Yeah. I've seen enough of you all to know where you're all sitting, and I'm happy with where all you're all sitting. So you should be really proud of yourself. Does anyone want to talk about their night?
Where we can see these things?
So this is called the ANSAT standards. So if you just type in ANSAT standards, and that'll bring up this website. That's
Yeah,
all I've done.
But you have, you will
Oh,
write something.
you can't see it yet because I've just got it saved in your file. So you'll see it in your Sonia.
Like after this placement or with?
No, you'll see it from tomorrow.
Oh, okay.
Yeah.
Oh.
So when when we go through it together, then I tick the button so you can see it. So you can all log in. You will not see it until we've sat down and had a chat.
Okay.
Do you all feel like you really want it today?
No.
Yeah,
it's okay.
because if you feel like you want it, I can just try and smash them out one at a time. Yeah. But yeah, no one should be worried about your assessment. It's just an informal chat, and then we talk about what you can do to try and do a bit better in a week's time. I'll do another one, informative. And that's your chance to tell me too what I can do better. So it's a two-way conversation, so how I can support your learning better.
Is it one-on-one?
Oh.
Like, is it like
One-on-one.
you and me or?
Yeah, one-on-one. Yeah, it's a private conversation. So what do you need to do better? What do I need to do better? And then so some students will say to me, oh, I think you're horrible. Okay, great. So what do we do? All right. Does anyone want to talk about their night?
So talk about what?
Their night, their
The night.
patient, their anything? Yeah. Has anyone else got questions?
Yeah, I have questions.
Yeah. All right, go on.
Some patient, the one patient is hiding her medication. How do we do that? Because we ask her do you have something regular medication? Yes, I did. But can you show me your medication? Because we notified the doctor, but she don't want to tell us. So we just discussed this problem and then called the other body nurse and talked to each other. And then I don't know the next situation. So if this happen, patient don't want to open her history of this medication. So what should we do that?
We need to go through every patient's bag, and if they've got medications, we've got to take them off them. They can't be taking their own meds while they're in hospital, because it's dangerous, because they can, especially if they're confused, they're taking too much, or we're giving them meds and then they're taking something else, so it's a no-go. Everyone has the right to refuse. I cannot tell you what to do, full stop. So patients have the right to refuse. Only if they're under the Mental Health Act can we search them, or they're under the police. So we can't just go, oh, well, let's just go to sleep and go through our bags. We can't do that. That's not ethical. So it would be a conversation with the doctor.
Okay. Yeah, we can conversation doctor.
Doctor, and escalating, so there's always somebody bigger. So there'll be a hospital manager on. So maybe escalating it up to the hospital manager. Making people aware.
Okay.
Good. What was your question, Ting?
I just got a patient. We because a patient from the theater, and he got spinal morphine, and so we got a chart. We need to fill that chart. The chart is Neuroxyl opioids single dose.
Yeah.
Yeah, we need to do some to check if her knees can move.
Yeah.
Yeah, every hour for 12 hours. I
Yeah.
forgot 12 hours, 6 hours, and this thing is dermatome level check. What is that?
So your dermatones, have you learned about your nervous system yet?
What's
No.
anatomy?
Okay, so it's a two-part question. Right, so where do they put a spinal medication? In your spine.
Yeah.
Good. Where does all the messages in your body travel through? So if you've got pain in your toe and it's got to tell your brain, where does that travel? Spine. Right. So you go in and you pop a needle in that spine, you can damage that. You can damage the bit that tells the knee to bend. Yeah. That's why you're checking that, because you've gone into the spine. So that's why you're checking that. All right, your axons. So are your dermatones. Your dermatones are those message systems. You'll learn this in pathophysiology. And these are how your dermatones come down from your spine. Let's see if I can get
Dermatose.
a good picture of your dermatones. Is this the same one? No, it's better. Okay. So it's C1, which is up the top here. That's where all this stuff works. So if you have a motor accident and it's C1, C2, C3, you break, do you know you actually can't survive? Because this is where your brainstem is. So you won't be able to breathe anymore. You'll lose your ability to breathe. And not because you're losing your airway, it's because the part of your brain that says, take a breath, take a breath, take a breath, is not getting that message. So these are those axons here. One common disease with your axon, these dermatones, is shingles. So are you all familiar with shingles? Yeah, it's a rash and it'll only be on that dermatome because it's a rash in the nervous system. So you might just have a rash that's only just here and you go, ooh, it looks a bit shingly to me. And we know because it's only on that dermatome, that messaging system. So that's what that is. Does that answer, Ting?
Yeah.
Yeah. Right, any more questions?
I'll go one more. I have a patient, she has dementia, but most of the time she's okay. And she got a form we need to fill is like record her behavior, like is she agitated or is she normal? And what if when we need to fill that for chart every hour? What if we miss one? Like we did 1 hour ago, she was like at 1, and 1 hour later, 2 hours later, it was 1 as well. So what if I missed 1 hour?
If you missed an hour?
I didn't, my body must miss 1 hour.
It doesn't matter.
It doesn't matter.
It doesn't matter.
But
Remember, in hospital, we're pushed to our max as a nurse. It's not ideal. You don't want it to happen. But some days you are so busy that you may just miss an hour.
so what are we gonna do with one?
Just leave it.
Leave it.
You can just leave it, yeah. If you've seen the patient in that hour and or if someone else has seen the patient, you might just be able to fill it in. You could just write workload on there. Too busy at workload. A lot of those are for funding as well. So just say we need to get a special. You've all seen specials that sit outside the room.
Yeah, we've got one.
Bed
Yep.
12.
So it gets the funding for that from the hospital. So if we can see that she's throwing and punching all the time, then when they go to the bed manager and say, we need a special on this ward, they've actually got evidence to take with them. Any more questions?
I have a question. I didn't have time to ask my body nurse. I just emptied the urinary bag for one patient. She was a female, like in his 70s or 80s, and it's like maximum 70 kilograms, and she has a urinary output of 850 mils over 10 hours. So it's like 85 mils per hour. So is that too much for her? Isn't that?
No, not too much. So we don't worry about too much.
No.
We only worry about a little amount.
Oh.
So if you go and drink 4 litres of water, how much are you going to wee?
Really not.
Yeah, have you ever done that where you've drank heaps of water and then you need to wee all the time? Yeah, you go out drinking with your friends and then you got to go to the toilet once you start. You just, yeah. So there's no maximum, but there's a minimum. Minimum's the big problem.
I also heard like another patient, like 3 liters over several hours, and the doctor, the GMO, was really concerned about it. So 3 liters.
About having 3 litres an hour.
Yeah.
The patient has multiple dehydration.
I don't know why the doctor would be concerned that he's had 3 litres out. Is there more to it?
No, I just, according to my instinct, I just feel it's too much. No, so we shouldn't be worried about that.
Particularly if you give them a medication like furosemide or a Lasix, you would have all given Lasix. They might go and wee 500 mils in an hour. So if you wee, I would imagine you would wee more than 800 mils in a day. Yeah? Yeah, you probably would, because we're up and drinking.
And do we need to encourage the patient to drink more? Because
Yes and no. So we can't just encourage patients to drink more because a lot of them have, if they've got wonky hearts or something wrong with their heart can't pump the fluid around. If they've got bad kidneys, their kidneys can't just pump it around. So in a young patient, sure. In a well patient, sure, just drink more water. But in an old patient, just be careful.
That's right.
Any more questions? How are you all feeling? Wednesday? Tired? I'm sleepy. I hate that my boss left and it was like 4:30 and I'm like, so what? And I'm like, what she said? Someone said to me, one of the girls messaged me this morning. They said, just want to check you're okay. You were really quiet yesterday. I'm like, yeah, I'm fine. I just hate an afternoon. And then my boss is like, you okay? And I'm like, you were the second person to ask me today. I'm just tired. I hate afternoon.
Yeah.
I'm so tired. And then before coming into work, you know, when you're just laying there and you're like, oh, I wish I could go to, because I can't sleep in the daytime. And then I just start playing solitaire, which I'm really good at, by the way. Well, I feel like I want to be doing all the Nirma, but it's way too early. And I've still got to go back. You know what I did do though? I did buy minties today so everyone could have a minty. But they're in my office and because we were going over there, I didn't bring them over. So you all have a minty tomorrow. A minty
Really?
and an answer.
Minty day.
Minty day. And then we will go through the head to toe, which we're going to do tonight.
Yeah.
So we'll go through that.
Yes.
Anything else you want to go through?
Can I also mention? Oh, sorry.
Pardon?
Can I just mention a patient? Today in our ward, one patient just passed away this morning.
Okay, yeah, I'm
Yeah, but-
aware.
Oh yeah, but actually, I didn't spend much time with him yesterday. I was just with him for like 5 minutes, and then today, someone told me that he was gone, and I was really shocked. Like, what happened to him? And I just really want to know what happened to him.
Yeah.
Yeah, but I just feel I'd better not ask.
Yeah. Are you okay?
Yeah, I'm okay. Just feel a little bit weird.
Yeah.
Yeah.
So I think he was an older man
Mhm.
and he had lots of problems.
Mm.
So they sort of knew that he was going to pass. I got told, because you guys are on the ward, so that they come over and they told me today that somebody had passed. When your first patient dies, the first patient you've been involved in or you spoke to, you will go home and often you'll have this empty feeling. Yeah? You might get in your car tonight and you just want to cry.
Yeah.
You might lie in bed and you might start crying. Just know that that's a normal reaction. Did you look after him as well?
Yeah.
Yeah? No. Okay. Because I checked with Ting before and then you were both busy when I come around to check. Yeah, so there will be that period tonight where you're going to have that grief. It might not hit you tonight. Sometimes we can get vacacious trauma, which will be in 3 weeks you might be shopping and someone will look like him and you will just burst into tears. They're normal things for nurses. Particularly, I can still tell you my first patient that died. Yeah. I will cry every time I've got patients that I cannot talk to you about because their death upset me so much. So I think, yeah, they knew he was going to sort of die. I think it was but it's hard.
Yeah, yesterday, the only talk I had with him was he pressed the buzzer and I asked what happened. He says that his bed mattress was not inflated and it was hurting his back, and I didn't know how to inflate the bed mattress, so I just told my body nurse, and they were busy with something else. And I think we came back to him in like about half an hour or something, and then fixed it. But still, now reflecting back, I'm really sorry. I just wish I could have fixed that for him.
Quicker.
Yeah,
You did the right thing and at least you fixed it.
yeah, but still,
But yeah, that's a lot. Yeah, unfortunately in nursing it's one of the best bits and it's one of the worst. But just know that sometimes the love and the care that we can give to patients and those intimate conversations, so those conversations with no boundaries that we have, make the biggest difference in those patients' final days. And just for you coming in and answering his buzzer and talking to him, and then getting someone to come back and then coming back and fixing it, like you would have made a difference. Yeah. He didn't die on an uninflated mattress. Like they're little things, but as a nurse, we don't forget the patients who die. It stays with us and it doesn't feel comfortable. No one else has had death on this placement, have they?
No.
No, I just had a whole group of high school students and they had 5 deaths in a day. And I could see, and one of them was a voluntary death. This was on the cancel. It was a lot. And you could just see them just shaking. And I just said, right, that's it, we're going out in the grass.
Is it legal now, I suppose?
Yeah, yeah. If you can. Yeah, so anyway, we all went out in the grass and it was a rainy day and it was cold and we sat on the grass and we've got this photo of us with these. And at the end of placement, they wrote me this beautiful card and they gave me this photo of me on the grass with them all. But they were only 16, 17. And they were in rooms and that was a lot. Oh, yeah, I'm sorry you were involved, but I'm grateful you were as well because I think you would have made a big impact on him. How about you, Hewan? You spent a lot of time with him or did you know him
No,
well?
just think about some patient. It's okay.
Yeah. Are you okay?
Okay.
Yeah.
I'm tired.
It is hard.
Yes.
The day you don't cry is the day you need to leave nursing. Stop it, because you've got a room full of cries. But it's true. That day when someone dies and you just go, oh well, another one bites the dust, that's your day done. So in nursing we have such beautiful hearts, and that's what you're seeing here. No other job cares for people either that are passing. Maybe if you're in aged care, but that's still nursing. So there's no other job, you know, you can't go and work at the tuck shop, or you can't go and work at David Jones, or...
I think when in aged care they pass away, it hurts more. Because you
Yeah.
be with them like in the whole time, and then you just go next to the shift, you like, they say, oh, she passed away, and you feel like, what? She was fine yesterday, you're like, oh yeah, she's gone, you know, he's gone. You just feel like that pain.
Yeah.
And that's, I think, more emotional. I don't know, when I started job, someone said, you don't get too attached with people in aged care. It will start hurting you a lot. I think there was one that really made me like think about like having that strong relationship. I was gonna get married back last year. So I was going home, and one of the residents, I was like, look, I'm going home, I'm gonna get married. He was like, do you think I will leave and see you in a bride dress? And I was like, what are you talking about? I'm getting in 2 months, you'll be fine. And then I got married, I came back the next day, he passed away. And he was still asking about me, like, why you guys didn't call me? Like, I came back, I could have come and see him. They were like, he asked about you, and then he asked about your photos, he saw my photos, and then that's it, he passed away. It was so bad, that just made me really, I still talk about him, I still get emotional, but it hurts really.
Yeah.
Even if you don't know them for a long time, but it's bad.
Especially when they're young, or when you can relate to them. So I had this beautiful lady, and I looked after her in the ICU, and her goal was to stay alive to Christmas Day, and we were 5 days out from Christmas. She wanted to see her daughter open her Christmas presents. But for me, my daughter was the same age, and I was excited because my daughter was starting school next year. And I remember just sitting, she was only my age, she was in her 30s, and I remember just going to this woman like, and so we were doing everything in ICU, just trying everything. I was going to do anything I could to keep her alive. And we were giving her all these drugs we wouldn't normally give, just trying to keep. And so things like that. She passed on Christmas, but she saw her daughter open a present. So things like that will stick with you. Those of you who have lost parents or grandparents, there will be patients that will remind you of that, and it will hit hard. That for me was probably 8 years ago. I can still tell you that lady's name. I remember her daughter coming in, and her daughter just sat with me at the nurse's desk and just was drawing. Didn't even care about her mum. Was just so happy. She's like, oh yeah, mum's here today. Like she was so accustomed to a mum that was sick that it didn't even... But I think it makes you a better person. And I think it makes you appreciate small things. Yeah. There's an attitude, so SCU, Donna Wilson. Do you all know Donna Wilson? Teaches at your uni. She come out the other week and she spoke to the students. And she was saying there's a personality of a nurse. And no one in this room's got it yet. But there's these certain characteristics that nurses have. And they're all and it's those things that we come across all the time that give you that. What's happening with you? No? Irina? At the moment. You okay?
All the time. I'm sorry, we have some laughing.
Why did you all come into nursing? What is that? with you, Sebastian? Why did you start nursing? Why nursing? Why not a better
For a
job?
better career.
A better career. Okay. Jamila, why nursing?
I don't know, I feel like all the time, I just want to be with patient, how they're feeling. I feel like all the time I need to serve people.
Yeah.
It's inside me.
Yeah.
Like I in my country I was dentist but not the doctor, not in a hospital. Dentist is like more in a room.
Yeah.
So I felt like in a hospital with so many patients, when they're in their bad time, worst time, the worst time,